I said, I think people are forgetting that there's patients beyond COVID-19 who need care, right? So I know in our hospital, we opened up our clinics back. We're back to 100% caseload since over 3 months now. But another thing that was held back, like I said, was instrumental assessments. So for those who are not aware, when someone comes in and says, I have a swallowing problem, we don't have X-ray vision. So we do something called a modified barium swallow study, or we do a fiber optic endoscopic evaluation of swallowing. So it's called FEES or MBS. So we have to watch the swallow in some way, and both of these are aerosol generating procedures. So I think one big change that came out of COVID is we couldn't rely on instrumentals. It's the equivalent of a neurologist relying on a CT or MRI and essentially going back to just using clinical skills and making the best decision for the patient. I what I want to urge people to remember is that was when COVID just hit us. We didn't know that social distancing works. We didn't know PPE works. Um, we didn't have a lot of protocols in place to minimize the spread of the virus. But now that we do, I just think we shouldn't be compromising on patient care in any way. I think we just, this isn't going away tomorrow. So, what I've tried to remind myself is that it's really scary and you're anxious because you're going back to your family. You don't want to get them sick. You don't want to get COVID, obviously, or pass it on to someone who's vulnerable because you're an asymptomatic carrier. But if we're making sure we're, following all the PPE protocols, sanitizing our rooms, we have HEPA filters, where we've modified our clinics to the point where there is social distancing in the waiting rooms. We have to get back to the same standard of patient care that we had pre-COVID, because there are so many sick patients out there and they continue to need our help. So that's one thing I want to make sure patients get access to. And I think the other really good thing that's come out of it is I think people are recognizing someone like me, like my role more in the team. And I like you're asking me these questions, and whoever's watching might learn something about speech pathologists today, which makes me really proud to advocate for my profession, because I really think it's undervalued, it's underappreciated what allied health professionals do on the whole. So I like that this all of this has come out of it, and I've learned so much from other professionals who may not have interacted with me as much before, because we really have to work with a team to help a COVID-19 patient recover to the best and get the best possible outcome. So I do believe that there's a lot of positives, and even though we have our masks, at the end of it, I think we've all come a lot closer. So I I think we learn a lot at the other end of this.